I am Dr. Paramjeet Singh. I am a neuroradiologist at PGI, Chandigarh. Immune compromise is a state where the body is not able to mount sufficient immune response against pathological organisms which attack our body. It actually changes the relationship of the pathogen with or disease producing organism with human body. Therefore, many organisms which are actually not causing disease in human body starts causing disease. They start attacking human body. Secondly, the response of human body to this kind of attacks is also altered because the body is not capable of mounting the right kind of reaction or protection against such kind of attacks. Therefore, the picture becomes very different from what we see in normal patients. Infections which are not seen in normal patients are seen in these patients. The reaction or the findings on imaging, that is the radiological test of imaging, are very different. They appear to be bizarre, unusual, or not so common. Therefore, the exact diagnosis becomes very difficult to guess, and unless this thing is kept in mind that the patient is having some kind of immune deficiency, such infections can be totally missed. And in fact, many times the attack by such kind of disease makes us aware that there is something wrong with immunity, and then we start investigating the patient. Therefore, we routinely do tests for immune deficiency in patients who have got unusual infections. We have certain infections like viral infections of the brain, which can happen to a normal patient, but many times we see that infections which are not normally seen in a patient's lifetime are suddenly manifesting in a very odd kind of manner. Say there are a lot of organisms which normally reside in our body. They do not cause disease, they do not actually cause any symptoms, but this kind of latency or hidden organisms, they suddenly flare up one day. When the immune status goes down, they start showing their manifestations, and then you come to know that there's something wrong with the immunity of the patient. Say for example, tuberculosis. It is so prevalent in India, it can happen to anybody. But suppose a patient has got HIV infection with HIV virus, there is a 100% more chance that the disease, which normally will not cause symptoms, starts manifesting. Similarly, there are other bacteria, viruses, fungus, all these organisms are there which are part of our normal body flora. That is normal body, they live with us in a symbiosis, but they all become pathological when the immunity goes down. So examples like infections of brain by cryptococcus, that is one organism, fungus like aspergillus, tuberculosis, and so many viral illnesses, they are all can be seen in these patients. Many times the radiologist is the first person who raises a red flag. He sees something on the radiology or imaging which makes him aware of something unusual going on, while the clinician is totally confused about why the patient symptoms are like this, and patient comes with a kind of his consciousness is altered. He has got say a meningitis which is not explained, and you do a tap of his CSF or fluid of the brain, you don't get any infection there, and the reaction of the body is actually not there for that infection, but his symptoms are too profound or too many. And then the radiological picture that we see on imaging, like imaging investigations like CT scan or MRI scan, they give us a clue that yes, the disease is too severe compared to what the patient is actually having symptoms of. And then he gives a guidance to the clinician that please investigate this patient on lines of something wrong with the internal environment of the body, and then they find out that the immunity is actually not protecting that patient very well. So this actually many times is the first way of picking up infections of this unusual kind which happen in immune compromised patients. HIV is a big health issue all over the world, and particularly in developing world, we are much more acutely aware of it can spread and it can cause disease to a large population, because we have developing world has its own problems like hygiene, living conditions, malnourishment, a lack of protection, screening, health facilities. All these things are lacking in developing world. Like Western world is very much aware of complications of HIV infection and how it spreads, how to screen patients. We have a very sturdy, very good program in India against HIV and tuberculosis, but our population is particularly vulnerable for this kind of infection because of lack of prevention or maybe lack of detection and so on, or lack of health awareness and so on. So HIV is an infection which actually enters into the body through mucosal membrane, and then it goes into a phase of latency. It doesn't manifest for many years, sometimes 10 years, but it is all the time there in the body. It enters into the brain and remains in brain, gradually causing destruction of the neurons, that is the brain tissue. So by the time the patient becomes symptomatic, he starts losing his memory or concentration, or he loses his mental capabilities. It's rather late stage of disease, what we call ADC, that is AIDS dementia complex. Dementia is forgetfulness and all these symptoms start coming up. During this period, the patient may remain healthy for some time and then all these symptoms start coming up. Unfortunately, in developing world like India, before HIV starts showing these changes of brain tissue loss, lot of these opportunistic infections, they start attacking the brain. That means the patient becomes symptomatic because of some other organism manifesting itself in the background of HIV. HIV, what it does is it kills the immunity. It's called the CD4 cells, which are killed by HIV, and therefore this cell mediated immunity, which is launched against a pathological bacteria or fungus or virus, is not launched. Therefore the body starts not recognizing these attacks, and attack really becomes totally fulminant or very severe, and then the patient comes to us. And that stage, unless we know that the patient has got HIV, we will never be able to reach the right kind of diagnosis. Therefore laboratory tests are important, but many times we suggest it for the first time. Okay, we are suspecting something which could be a manifestation of something unusual going on in the human body. Now once we started treating HIV with antiretroviral drugs, the chances of infections have started coming down. Therefore in India we have more infections, while in West we have more of dementia, that is loss of memory. So this is the difference between the population which is in the developed world and the developing world. Our aim should be to reduce the incidence of opportunistic infections of brain, because these are the killers which can come up suddenly and kill a patient, and this can only be tackled by increasing the immunity of these patients by giving them antiretroviral therapies, and that is something which has really changed the world over, the scenario of how these patients behave. They have a kind of very stormy course of life. They suffer from infections, they recover, and then they go into dementia, and it's not a very normal life which they have. But I think we can help them by being very judicious about our tests, being aggressive in treating, detecting, screening of patients, and picking up the disease at the right time. So my message is that if we really are aware of what we can encounter in such kind of patients, probably we pick up many more patients and give them the right guidance. The diagnostic radiology is one subject which is technology related, and whatever is happening in the world of science and IT, computers and hardware, software which is related to medical field, the first benefit actually comes to radiology, because it leads to improvement of machines, the MRI scanners, CT scanners and angiographies and so on. So technology is advancing very fast. We used to do only conventional imaging few years back, where we'll just see the sections of the brain or take X-ray and try to judge or guess what the disease is. But now we are going more and more into physiological imaging. It is because of the faster computers. The computers are very fast, therefore your data processing and your data, which is actually three-dimensional in space, is acquired at a very fast speed. This increased speed has given us an opportunity to not only do higher quality, better resolution imaging, but also pick up small physiological things like blood flow into a tissue, or maybe diffusion of water inside the brain tissue. These are all very important factors which decide what the disease actually is. So, with advancement of computers and IT and biomedical field, which is a partner of medical sciences, we believe that we will be doing more and more physiological studies and biochemical studies, say picking up chemicals in the brain, which will be far more informative and far more definitive about the diagnosis rather than to guess it. So, we are heading to a very bright future as far as human disease diagnosis is concerned.